Hello, this is Dr. Arhiri with Premier Smiles on Berwyn. Today, we're going to be discussing the teeth whitening procedure. The procedure for teeth whitening encompasses application of a gel, which is peroxide of different concentrations, usually more in the office versus the ones used at home. And a light or a laser activates the gel, extracting the stains from your teeth, and this way whitening the teeth. The at-home teeth whitening is not as effective for the simple fact that the concentration of the peroxide it's way less because that's a liability issue. The companies don't want the patient to hurt themselves while applying the strips or the trays at home. The best option is with prefabricated trays done by the lab, and then the gel, the peroxide is applied in the trays, and then the patient can apply the trays on the teeth for them to whiten. They absolutely help, but it depends how deep the stains are and how the structure of the tooth looks like. If there is something more deep into the structure of the tooth, then baking soda or any other product might not really give you the desired result. They're pretty much, a lot of them are the same. They use the same kind of concentration of peroxide gel because that's the main component. And it all depends of the structure, structure of the teeth. On some patients, the result is more pronounced versus other people. And that has to do with wear and tear and has to do with simply the composition of their enamel over the years. The first thing is concentration of the peroxide. The higher the concentration, the better the results you will have. And pretty much highly encourage people to go and seek the help of a dentist, at least for a consultation, to see if they are even candidates for a whitening before they spend the money for buying the kits. To whiten your teeth at home, it can be done every 3 to 4 months with no problem, and in conjunction with the whitening toothpastes and mouthwashes or baking soda or whatever other products a patient might want to use. The simple benefit is just the peroxide itself, the gel, because that's the main component which whitens the teeth. Everything else, and it has the most efficient way of extracting the stains from the teeth. The other home remedy products, they do help, but they're not as efficient. It's only temporary results a lot of the times. It has to do with the composition of the enamel of the person. Also, diet has a big factor into whitening the teeth. It's recommended that for the first couple days to have a completely white diet. The rule of thumb is anything with stain a white shirt, you do not put in your mouth. Avoid smoking and any kind of dark liquids or dark foods to touch the outside of your teeth. If you do not have any kind of dental work done and your teeth are in fairly decent condition without cracks and too much wear and tear, then you should be a pretty good candidate for a home tooth whitening. The first step would be obviously to brush your teeth really good, and then you can apply the kit for whitening your teeth, and then afterwards follow the rules as far as with foods and drinks. The only risk that it can be with this at-home kits is you can get a transitory sensitivity on the teeth, and sometimes you can get it on the gum as well. At-home kits do not damage the teeth. Everything should be, it's pretty safe, so the patients can do it with no problem. This is Dr. Arhiri with Premier Smiles in Berwyn.